Hello everyone, welcome to HIM 216. This is a continuation of the lectures covering Chapter 6. And this is Lecture 11 for Chapter 6, and we're starting on the bottom of page 128. And the section of the guidelines that we're covering now are the body part guidelines. And we begin with the general guidelines and this is a guideline we have looked at, that if we have a procedure that's performed on a portion of a body part that doesn't have a separate body part value, then you code that to the whole corresponding body part. Now the example they have here is a procedure that's performed on the alveolar process of the mandible. So again, this is an example of when we would go to the body part. In HELP, we would go to the body parts, and you can see here, let's see, let me get back up to the A's. The alveolar process of the mandible says to use the mandible. The alveolar process of the maxilla tells us to use the maxilla. So this is an example of when you would want to go in and use that body part guide. Now, also sometimes procedures will use the term peri, such as in periappendicular and perirenal, and the guidelines tell us that we code it to the body part as named. So if it said periappendicular, we would code it to the appendix. If it said perirenal, we would code it to renal. So on the top of page 129, we have an example, percutaneous drainage of a left perirenal abscess. So we'll be in medical surgical for this. And then a perirenal abscess is part of the urinary system. And this root operation is drainage, so we will choose drainage. Now when we get in here, we don't see renal anywhere, but we see kidney. And so we are going to choose the body part for the left kidney. And our root operation for this is going to be, our approach is going to be percutaneous. And then it doesn't tell us that a drainage device was inserted, so we're going to choose no device and then no qualifier. So the code for this example would be 0T913ZZ. Now branches of body part, and this is just like those general guidelines. If there's a branch and it doesn't have its own body part, then you code it to the closest proximal branch. And the example that they have here is a mandibular branch of the trigeminal nerve. So let's go back to our little body part guide here. And if we go down to, and we want to find the mandibular nerve, and we can see mandibular nerve listed right here, and it says use trigeminal nerve. And in our example, it actually says release of maxillary nerve. So if I come down and look at maxillary nerve, it tells me to use the trigeminal nerve. So I know that my body part is going to be trigeminal nerve. And we're coding a release. We're in medical surgical, and the trigeminal nerve is part of the central nervous system. And our root operation for this is a release. And then our body part is the trigeminal nerve. Now our approach for this is going to be open, and then there's no device and no qualifier. 00NK0ZZ. If we were looking at the operative note, it would describe this approach as being open. In this instance, it doesn't tell us the approach, so we are assuming open. Now, the next guideline talks about bilateral body part values. And if you're coding a bilateral procedure, and that means they did the same thing on corresponding body parts, then you can, and there is a bilateral code, then you can choose it. So as an example, we're going to look at a tubal ligation. And when we do a tubal ligation, as we said earlier, we want to have an occlusion. We want to make sure that is completely, those tubes are completely blocked. And so you'll notice that we do have a body part for the right and the left, and then one for bilateral. If it's bilateral, we're going to choose bilateral. Now, in the example that we have, number 29, this is actually a laparoscopic occlusion. And so our root operation is going to be percutaneous endoscopic. And it tells us that they used extraluminal clips, so we're going to choose extraluminal device, and then there would be no qualifier. Now I want to point out that there are times that maybe a woman has had one of her tubes removed, and she elects to have a tubal ligation on the other side, and so that would be an instance where you would choose either the right or the left. But if it's bilateral, you want to choose the body part for bilateral. Now let's look at bilateral knee replacements. And sometimes patients come in and they want to have, they'll have bilateral knee replacements. And the knee is a joint, so we would be choosing joint, and then we would be choosing replacement for that particular joint. Now we have, when we're looking in here, we see knee joint right, knee joint left. There aren't any bilateral body parts here. So in this instance, we would have to code both the right and the left, and we would choose synthetic substitute if we didn't have, it wouldn't be autologous tissue. They wouldn't be taking tissue from the knee if they're doing bilateral, and then it would not be an autologous tissue substitute. It'll be a synthetic substitute, and then we would choose no qualifier. So for the right side, it would be 0S RC 0ZJ. And for the left knee, we would just simply change that body part 0SRD 0JZ. Sequencing does not matter in this particular example. Now let's talk about coronary arteries. We're still on page 129. It's guideline B4.4. And this tells us that coronary arteries are classified as a single body part that is specified by the number of sites treated and not by the number of arteries. Let's go take a look at this. So if we go into medical surgical and we go into heart and great vessels, we looked at this when we were looking at bypass. Let's look at dilatation. That's what our example is going to be. And so you can see here that for coronary arteries, there are no names for coronary arteries here. It's defined by the procedure and whether or not a distinct procedure was done on more than one site. If the same procedure was done on 2 coronary arteries, then we can choose 2 here. The example they have is an angioplasty of 2 distinct sites in the left anterior descending coronary artery. They placed 2 stents, and so because they placed 2 stents, they did exactly the same thing at each of those sites. We can choose coronary artery 2 sites. Typically this is done percutaneously, and it says they put in stents. It does not say they were drug-eluting stents. And if you look at these devices, we have drug-eluting stents, and then we have intraluminal device, and that is a non-drug-eluting stent. Then we have a device radioactive or no device, and they can do a PTCA and not place a stent. They can just go in and dilate that coronary artery. So we're going to choose intraluminal device. This was not at a bifurcation. It's no qualifier. So in this example where they treated 2 distinct sites and they put the same type of stent in, our code would be 02713DZ. And this would be a PTCA, percutaneous coronary angioplasty. Now, in the next example that they have at B4.4, we're doing an angioplasty of two distinct sites in the left anterior descending coronary artery, one with a stent placed and one without. So in this example, we would have to code each of these sites separately. So we would have coronary artery one site percutaneous, and we would actually have the code for the stent, intraluminal device, and no qualifier. And this is actually the code that we would sequence first, 02703DZ. Now, for the stent where they use no device, that code is 02703ZZ. So that's they did two different procedures. They dilated the artery. At one site, they put in a stent. At the other site, they did not. So 31, this is the example that we just did. Coronary artery, two sites with two drug-eluting stents, 027134Z, and then PTCA, two distinct sites, one with placement of a non-drug eluting stents, and the other one didn't have anything placed. So the first code would be 02703DZ. This is the procedure where they placed a stent, non-drug eluting stent, and then the other code would be 02703ZZ because they did not place a stent. They performed the dilatation, they performed this root operation of dilatation, but they did not put in a stent, they did not use a device. Okay, now let's look at B4.5, tendons, ligaments, bursa, and fascia near a joint. I want you to notice that when we're in medical surgery and we go to body systems, you can see that we have a specific body system for muscle, we have one for tendons, we have bursa and ligaments, and then we have joints, upper joints and lower joints. So what this guideline tells us is that the procedures performed on tendons, ligaments, bursa, and fascia that support a joint, then you code those to the body part in the appropriate body system. Because that's the focus of the procedure. If the procedure is performed on the joint itself, then you choose the body system for the joints. Now they have an example here, repair of an anterior cruciate ligament of the knee. That's coded to the knee bursa and ligament body part. So for instance, we are going to go to bursa and ligament, and this is a repair. They said that this was a repair, and they tell us knee. So let's see what we have here. They don't tell us whether it was left or right, so we're just going to assume that it was right. And they don't tell us whether or not we're going to say it was percutaneous endoscopic. They don't tell us an approach. And so this is an example of how we would do the repair of a ligament. Now in the next example, they have a knee arthroscopy with shaving. And so what happens with this one is that this is actually a procedure performed on the joint. So we're at lower joint, and this shaving is actually an excision. It is cutting out or off without replacement a portion of a body part. And again, it doesn't tell us whether it's right or left, so we're going to choose right. percutaneous endoscopic, no device and no qualifier. 0SBC4ZZ. Now turning to page 130. We have guidelines, the guidelines for the skin and subcutaneous tissue and fascia overlying a joint. So if a procedure is performed on the skin, the subcutaneous tissue, or the fascia that is overlying a joint, then the procedure is coded to the following body parts, and it lists those there for you. So if someone has a laceration to the skin of their shoulder, it's coded to upper arm, elbow to lower arm, wrist to lower arm. So if I wanted to code the suture of a laceration, I have to go to skin and breast. And then my root operation is gonna be repair. And you'll see that shoulder is not listed here. Shoulder's not here. So shoulder is coded to upper arm. So I would have to go and find skin, right upper arm. And then my approach is external. Sutures of skins are always external. And there's no device and there's no qualifier. So your first question for this lecture is that I want you to code a laceration of the wrist on the left. Code a laceration of the wrist on the left. Okay? And then if we look at 33, which is a suture of the laceration of skin, left knee. For knee, we have to go to lower leg. So we would be going to skin, lower leg, and this is the left. Okay, external, no device, and no qualifier. So, 0HQ LXZZ. Okay, now looking at 33, this is a laceration of the skin and subcutaneous tissue. So we would be choosing, rather than skin and breast, we would be choosing subcutaneous tissue and fascia. Our root operation is still going to be repair, but our body part is going to be subcutaneous tissue and fascia of left to lower leg, and the approach here is going to be open. If it's skin, the approach is always external, but when it goes into the subcutaneous tissue, then that becomes open, and then there's no device and no qualifier. So for the suture of the laceration of the skin and subcutaneous tissue, 0JQ P0ZZ. Now, fingers and toes. Now, if the body system doesn't contain a separate body part for fingers, and procedures were performed on those fingers, you code that to the body part value for the hand. The same thing with toes. If there's not a separate body part value for toes, then you code it to foot. And the example they have is excision of finger muscle is coded to one of the hand muscle because the body part value in the muscle system. So let's just take a look at this. So we're going to be in medical surgical, and we're going to choose muscles. Our root operation is going to be excision, and you'll see that when we look at this, fingers are not listed here. Toes are not listed here. Our only option is hand or foot. So we would be coding this to whichever right or left side the procedure was performed on, and we would, if it were fingers, we'd choose hand, and if it were toes, we would choose foot. B4.8 tells us that in the GI body system, we have a general body part for upper intestinal tract and lower intestinal tract. And for specific root operations, change, inspection, removal, and revision. And it tells us that the upper intestinal tract includes the GI tract from the esophagus down to and including the duodenum. And then the lower GI tract includes the jejunum down to including the rectum and the anus. So we have an example here. Let's go and look at medical surgical, and we're going to choose the GI system. And if we go to the root operation change, you can see that we have upper GI and lower GI. We don't have anything more specific than that. So choosing upper or lower would be driven by this guideline B4.8. So this might be something that you want to put on a note card. 34, excision of hypothenar muscle on the right. So I'm just going to guess that hypothenar muscle is not going to be one of our body part values. So let's go to our table and look up hypothenar muscle. And hypothenar muscle we have to code to the hand, either right or left. So, and this is excision, so we're at medical surgical, and this is a muscle. And root operation is excision, and this is the right, so we'll do the hand muscle right, and we're going to say that our root operation is open and there's no device and no qualifier. So the code would be 0KBCOZZ. Now the next guidelines that we're looking at concern the approach. And it tells us that when we have procedures that are performed with an open procedure with percutaneous endoscopic assistance, those are coded to an open procedure. So if we look at this example, laparoscopically assisted sigmoidectomy, we're in medical surgical. The sigmoid is a sigmoid colon. It's in the gastrointestinal system. And the GI system is one of those that the colon is broken down into parts. And so if it says that it was a sigmoidectomy, that means that they did a resection of all of the sigmoid colon. And we would be choosing N as our body part. This is open, no device, no qualifier. 0DT, N0ZZ. The next guideline talks about the external approach. If we have a procedure that's performed within an orifice on structures that are visible without the aid of any instrumentation, the approach is external. And if I go to tonsillectomy, and when they do a tonsillectomy, the intent is for it to be a resection, to take out all of the tonsils. And so when we go into mouth and throat and we choose resection and we choose tonsils, it can either be open or external. External is the approach that we are using with no device and no qualifier. So 0CT PXZZ. Now, B5.3b. If we have procedures that are performed indirectly by the application of external force through the body layers, that is called external. And the example is closed reduction of fracture is close to the approach external. And literally a closed reduction means that they applied pressure to the skin to get the fracture back in place, and they'll always x-ray it to check and make sure that in fact that happened. So we're looking at, the example is closed reduction of left distal radius fracture. So we're in medical surgical, upper bones, radius ulnar in the arm. And then this is repositioning. When they reduce the fractures, they reposition them, and this is the radius left. The approach is external. There's no device and no qualifier. 0P S J X Z Z. Now on the top of page 131, procedures performed percutaneously via device placed for the procedure are coded to the approach percutaneous. And the example for this is fragmentation of right kidney stone performed via a percutaneous nephrostomy. So this is lithotripsy. So we're in medical surgical, and our body part is going to be the urinary system. And our root operation is fragmentation. And it's the right kidney. The approach is percutaneous, and there's no device and no qualifier. 0TF33ZZ. Device. We only code a device if it remains in the body after the procedure is completed. If no device stays in the body, then we don't code it. So the example we have is a percutaneous insertion of a central venous line in the internal right jugular. So we're in medical surgical, and we're in upper veins, insertion, internal jugular vein right. Our approach is percutaneous. It's an infusion device, and there's no qualifier. And so why would they put a device here? Because they're going to be infusing this patient with some substance on a regular basis. This is the code for the insertion of the catheter. It's not it's not the administration of the substance. So this could be hyperal, it could be chemotherapy, but they're putting it there. There's a port. The port has to be flushed on a daily basis. You have to be very careful with them not to get them infected. B61B tells us that things such as sutures, ligatures, any radiological markers, any temporary postoperative drains are integral to the procedure, and they're not coded. If procedures are performed on a device only and not on a body part, the root operations change, irrigation, removal, and revision are coded to the procedure that was performed. And the example here is irrigation of a percutaneous nephrostomy tube is coded to the root operation irrigation of indwelling advice in the administration section. So let's look at how we would code irrigation of left percutaneous nephrostomy tube. We would be in administration. And then this is an indwelling device. It's not circulatory like a blood transfusion. It's not physiological system as if we were doing bone marrow or pancreatic islet cells. This is an indwelling device. And it's irrigation That's our only choice. And you can see that the code actually fills in for us 3C1ZX8Z. And then our last guideline, B6.2, we have a separate procedure to put in a separate procedure to put in a drainage device is coded to the root operation drainage with the device value being drainage device. So let's say, and this is in reality, we would never code the insertion of a Foley. This is just for examples only. Inserting Foley's is a nursing procedure. Nurses are trained to do this, and we do not code procedures typically that are performed as a part of the routine nursing function. However, we're going to demonstrate this. We would be in medical surgical, and we would be in urinary system, and then our root operation would be drainage, and it would be a bladder. When we put in a Foley catheter, we're putting that catheter into the bladder to drain the urine, and our root operation would be via natural or artificial opening. You go in through the urethra, and we would be choosing drainage device, and there would be no qualifier. So 0T9B70Z. So that's going to conclude Lecture 11 for Chapter 6. Our next lecture will be the final lecture. We're going to go over Exercise 6-7, and then I am going to record a lecture for you to go over some of the questions in the chapter exercise. That won't be required, it won't be graded, it'll be there if you want to listen to it. So that will conclude this lecture.